My name is Dr. Suzanne Fletcher. I'm the clinical coordinator at Uninsured Recovery. We're honored that you are all here and have chosen Insured Recovery to be your recovery journey service provider. Today I'm going to talk about Suboxone, the administration of it, and the storage of it. The first thing I'd like to start by saying is what we do when we are starting Suboxone. The importance of making sure that you are in some degree of withdrawals is vital. If you have other drugs, especially other opiates in your system, you're at risk of developing precipitated withdrawal if you are not clear or clean, almost clean from most opioids in your system. Precipitated withdrawal is horrible. You feel like you're going to die, but God doesn't want you. So you sit there and you suffer, you feel sick, you feel nauseated. It's horrible. So anytime you're thinking of starting induction with Suboxone, make sure you have got into a good withdrawal with strong withdrawal symptoms. And these withdrawal symptoms range from restlessness to heavy yawning, to enlarged pupils, to runny noses, with tears in your eyes, body aches, tremors, twitching, chills and sweating, anxious and irritability, goosebumps, stomach cramps, nausea, vomiting, diarrhea, joint and bone aches. When you have achieved at least 3 to 5 of those symptoms, then it is deemed appropriately safe for you to start taking your Suboxone or your buprenorphine product. It usually averages out to being 12 to 24 hours since you last used heroin or fentanyl before you can safely take buprenorphine. 36 hours since you have snorted pain pills such as OxyContin or morphine. 12 to 24 hours since you have swallowed pain pills, the shorter acting like Percocet, Vicodin, hydrocodone, or heroin. And greater than 48 hours since you've last used methadone. Once you decide you're going to start taking buprenorphine product and you are in withdrawals enough, or you are already on buprenorphine and want to continue it, it's very important that you take it correctly. If there's nothing else you hear from me today, I want you to understand the importance of taking it properly. The first thing you need to do is storage of it. It must be stored in a safe place. You know, if any of you have children, how they like to poke around, especially teenagers and little toddlers, make sure it is stay safe and secured away. You also can have friends who come over to check out your house to see what you got. That's good. So make sure it's stored away safely. Second of all, when you get ready to take your Suboxone, whether the films or the strips, the first thing you do is try to not eat, drink, smoke, or talk. They don't say that you have to take it on an empty stomach, but they don't want you to take it on a full stomach. Because what happens at that time is when you eat a heavy meal and then you go to take your buprenorphine product or Suboxone, your blood vessels have opened up and all the blood is now moved to your stomach to help digest your food. So if you have digestion going on and you're trying to take Suboxone, and that Suboxone needs the blood that's now in your stomach also needs the blood to take the medicine to your brain receptors, then you're not likely going to get the maximum dose of medicine that you should get. So they recommend it. If you have to have a light meal, because some people do get nausea, that's fine. But preferably try to take it on not have it eaten for say 30 minutes. So I always recommend people no eating, no drinking, no smoking, no talking. If you eat, drink, or talk, you're going to swallow the medicine. And if you swallow it, it doesn't digest in your stomach like Tylenol does or other medications. You actually just poop it out. If you smoke, the nicotine in the cigarettes causes those big fat blood vessels under your tongue. Those are the same blood vessels that the medicines absorb through to narrow. So if you have constricted or narrow blood vessels, you're not going to get full absorption. The reason why the inside of your cheeks are so pink, your tongue is pink, is because those blood vessels are near the surface. So therefore, the more you let the medicine marinate in your mouth and under your tongue, the more absorption you're going to get. The entire process should take place mainly in the mouth. So I have people swallow some water, rinse their mouth out, get rid of the morning gunk if you take it in the morning, and then put the film or tablet under your tongue. Let it sit there for a good 20 to 30 minutes. About minute 11 to 15 is what the manufacturer says you should feel a little boost. That's when the medicine has started to be absorbed, dissolved enough to be absorbed from those blood vessels under your tongue to go to the receptors in your brain that click into those receptors and prevent thoughts of using, cravings, and withdrawals. So it's important, if nothing else, making sure you take this medicine correct. You will absorb in more of the medicine, therefore you will feel better. You will have less complications of feeling that you need more medicine. You'll have no cravings, no withdrawals, and no thoughts of using. So that's a primary thing. Once the medicine has been absorbed, it takes about, I would say, wait 30 minutes if you can, 25 minutes. I always tell people, get up, do it first in the morning before you have cleaned your teeth. I don't want any Crest or Colgate between you and your medicine. Go ahead, go about your morning, make up your bed, shower, get your coffee ready, but don't drink, eat, smoke, or talk. Once that's done, in about 30 minutes, you can go ahead and eat, drink, smoke, and talk. The longer you hold off smoking, naturally, those blood vessels will be still open. So any residual medicine will still continue to be absorbed. Within the hour, I would always clean your teeth. It does cause problems with tooth decay and gum disease. You wouldn't send your kid to bed with a mouthful of candy. Don't go around the day with a mouthful of Suboxone. It will cause tooth damage and gum damage. The big side effects of Suboxone is constipation, constipation, constipation. If you haven't pooped one day, go ahead and take something that night. There's nothing more awful than feeling bloated and uncomfortable. I recommend Miralax, milk of magnesia, stool softeners, or a combination thereof. And just take it. Some people don't like to take this regular, and I understand, because then you can create other problems. But if you are prone to constipation, don't let that be a deterrent and be uncomfortable. That's the first side effect. The second side effect, which is something that almost everybody has, and it does not mean you're withdrawing or your dose needs to be higher, is sweating. This is a side effect from most people who take this medication. You just break out in big pores of sweat. It could be freezing. You'll still have a moment where you'll just sweat. Your medicine is fine. It's just a side effect. There's nothing to worry about, okay? The other common or less common side effects includes sometimes some dizziness, especially when you stand up, or I would recommend you make sure you drink more water. Not only that help with the dizziness, but it will help with the constipation. The sweating, drink more water, shower more often, dress in layers. Sleep problems. I don't recommend that you take the medicine 4 to 5 hours close to bedtime. You need to take it at least 4 to 5 hours before you go to bed. The reason for that is the medicine is known to cause insomnia and crazy dreams. Those are two situations that anybody in recovery do not need. So if you go to bed at 10, take the medicine no later than 5. So you get a chance to sort of settle into your system, and then you are able to sleep better and not have the crazy dreams. Some people say they have an upset stomach when they take the medicine, and so I recommend they don't swallow it on completion of it dissolving. You can spit it out. That's perfectly acceptable according to the manufacturer. If your stomach issues become significant, you could have something light to eat, like yogurt or something light that would kind of buffer the stomach. If that becomes severe, talk to your provider, because we can offer you some stomach medications that might help. Those are the biggest side effects. However, the serious side effects, if you start to notice dark or tea-colored urine, you get a bad stomach ache, you get light-colored bowel movements, you get yellow in the whites of the eyes, or a yellow skin, those are signs of liver damage. And Suboxone, as with most medications, can cause liver issues. So I would be sure to go to the emergency room, contact your provider if those things occur. That is my talk on storage and administration of Suboxone. If you have any questions, please reach out to the provider that sees you today. And I will be trying to do another talk on the injectable buprenorphine products, which is mainly Sublocade and Brixadi. So that will be coming next. And for those of you who might be interested in knowing more about that, discuss that with your provider. You all have a good day, and thank you for listening. Take care.